afternoon, everyone. Thank you, AIOC, for giving me this opportunity. Myself, Dr. FATEMA Noble. I'll be presenting on assessment of contrast sensitivity by Spaeth-Richmond contrast sensitivity test in glaucoma patient. So as we all know, glaucoma patient describe their visual compromise as blurring of vision and needing more light to perform any task. While a glaucoma specialist will equate these changes with the visual field printout while communicating with the patient. But as the patient is confused, unable to correlate between vision and vision-related quality of life. Hence, the glaucoma specialist should include contrast sensitivity assessment for glaucoma assessment. Now, as we all know, around 30% of axons are lost before any defect appears on the visual field printout. This inadequacy of the visual field printout to detect early glaucomatous changes had led to attempt to measure by contrast sensitivity. We will be concentrating on Pelli-Robson and Spaeth. Pelli-Robson contrast sensitivity test. It is a wall-mounted chart which is read at 1 meter with letters at constant size with decreasing contrast. 2 triplets of varying contrast are used, and the faintest triplet, in which 2 out of 3 letters are identified, a log CS value is obtained. But this measures only central contrast sensitivity, which is an inadequate measure for peripheral field defects. So we come to Spaeth, which measures spatial contrast sensitivity in both central and peripheral visual field. So how is it done? It is performed on a standard computer on visiting www.spaeth.com. On entering the basic information, the patient logs into the page. On entering the page, every patient will get its unique identification number, which can help the patient for the further follow-up. On logging into the page, the basic eye information is filled. On filling the basic eye information, the test is started. It tests the contrast sensitivity in central quadrant and in 4 peripheral quadrants. It is tested monoocularly with patients seated 50 cm from the computer. On selecting the eye, the patient will see a vertical contrast grating in different quadrants while maintaining a central fixation. A score out of 20 is obtained for each quadrant, making a total score of 100. Patient for BCVA, slit lamp examination for anterior segment, intraocular pressure examination, posterior segment, visual field defect by Humphrey field analyzer, and contrast sensitivity by Pelli-Robson and Spaeth. 174 eyes of 111 patient were analyzed, consisting of 87 in cases and control, equal distribution in gender and laterality, none of which affect the Spaeth score. Mean age came to 56 years, and on pairwise analysis, intraocular pressure, cup disc ratio and disc damage likelihood score was more for glaucoma patient as compared to control. We also compared Pelli-Robson and Spaeth score for different study group, and we could find out that the control had a higher score than the glaucoma patients. On univariate analysis, there was a positive correlation between Spaeth and Pelli-Robson. On plotting an ROC curve for Pelli-Robson, it had a sensitivity of 83.9 and specificity of 59.8. Similarly, plotting an ROC curve for Spaeth at a cutoff at 70 had a sensitivity of 83.9 and specificity of 96.6. On comparing the ROC curve for Spaeth and Pelli-Robson based on perfect classifier, the Spaeth was much nearer to the upper left quadrant, indicating a better performance. Now, all this study has been already done. What new this study adds? We also plotted an ROC curve for different quadrants like upper nasal, upper temporal, central, lower nasal and lower temporal, and we could found that the ROC curve and the area under the curve, sensitivity and specificity was much higher for Spaeth as compared to Pelli-Robson. So we conclude that Spaeth and Pelli-Robson tests demonstrate high degree of correlation, can be used interchangeably. Spaeth is independent of effect of literacy in contrast to optotype-based Pelli-Robson chart, and Spaeth measures both central and peripheral contrast sensitivity, which is better for glaucoma patient with peripheral visual field loss. So this was already known that Spaeth can be used as an alternative to Pelli-Robson test. This study adds that the current gold standard of contrast sensitivity needs to be replaced with a new and more accurate test like Spaeth. Thank you.
Hi, thanks. Nice paper.
Thank you.
Just a couple of questions. Whenever you present a study, you have to include ethics and you have to include informed consent. Both were
Yes.
missing from your. So did you take
Yes,
ethical?
ma'am, everything was taken. Yes,
before.
ma'am, yeah.
So that's not included. The other thing is that the same regions are not tested in both. So how are they comparable? You said that one tests the center and the other tests center and periphery. So how can you
Yes.
compare both because different regions of the retina have different contrast, we know that.
Yes, ma'am. So for all the patient with upper nasal quadrant defect,
No, but they are not being tested by pelirrobson, na?
yeah, they are not being tested. So this will give like the people who have a peripheral visual field defect, they came with a normal pelirrobson test or like a normal pelirrobson test result. But patient with sparks who had a very early nasal step or a peripheral arcuate defect, they showed changes in sparks.
But that's because pelirrobson is not testing the periphery.
The periphery, yes, that is the whole purpose of the sparks, ma'am. Yeah.
How could you say then that they can be used interchangeably?
Uh,
You said you concluded. How this conclusion could be drawn from this study?
pelirrobson was a gold standard test, so we could use sparks instead of pelirrobson. Right? They showed a correlation was positive correlation.
Any other judges? Any question?
Did you look at anything like a lens opacification score system before?
Yes, sir.
Okay.
Yeah.
Did you some cutoff before
Yeah.
you thought the patient was eligible, because that can affect contrast,
Yes, sir. Yeah. So visually significant cataract, LOC grade 2 more than 2 were not included.